Hello, everyone. Good afternoon. I'm Gary Toh from Chimay Medical Center of Taiwan. So it's my pleasure to be here to represent the pole position for prescribing statin in middle-aged and older adults living with HIV. The first question I'm going to ask you is, do you like dim sum? I love them, right? But after I eat it, the only thing I'm scared about is lipid, sugar, all these things. So actually, dyslipidemia is a very important issue, especially in people living with HIV. As we know, the cardiometabolic disease is increasing in this population, especially dyslipidemia in those who are taking antiretroviral therapy. So what can we do about the lipid is we got a drug called statins, and statins did save life. As we know, the lowest LDL that we have, it will be the best to prevent us from getting cardiovascular disease. And especially in those with high-risk diabetes, chronic kidney disease, statin has undoubted effect for the secondary prevention of cardiovascular disease. But what happened in the people living with HIV is that there are already evidence showing that if you take statin, you are less likely to be dead. Like in this study, in this cohort, that actually statin use had been associated with lower hazard ratio for mortality. And what happened in last year is the occurrence of the REPRIEVE study. I'm sure most of us has heard about that. And this randomized control trial that involved 12 countries, including India and Thailand, has shown that the people living with HIV with low to moderate CVD risk, after you're taking the statin, you are less likely to have cardiovascular disease. So in this study, as what we can see here is that there's a 35% decrease in the occurrence for the first major adverse cardiovascular event, as well as 21% decrease in the first MACE or death. So what happened, what we can learn from this study is that statin use normally were based on the LDL level, right? You have a high cholesterol, for sure you need to take a drug to treat it. But in this study, what the median of this population taking the statin is about 107. That means that it is normal LDL, but it is still beneficial. Why is that? As we know that actually these people living with HIV are at a higher risk for CVD, and with a risk ratio of 2.16. Actually, this is quite high. As we know, the diabetes people, they got the risk for CVD is about 1.5 to 2 compared to the general population. So, and then the most important thing is when we calculated the risk for these clients, actually we didn't consider the HIV-related risk factors. So the risk is always underestimated if we use the traditional calculators to account for the CVD risk. And there's another concept is that we are not going to wait until they have a high LDL, because there are more and more evidence showing that the risk of CVD is strongly correlated with the cumulative exposure of LDL in your lifetime. So that means that once you have a higher and higher LDL, it's time to start to deal with that. And another thing is that statin has a pleiotropic effect. It's not only about lipid lowering, but there's a multiple function of statins, including anti-inflammatory, antioxidant, and anti-thrombotic. It has been proved in many other studies. As well as you can see here, there are more and more evidence showing that people taking the statins will have a lower risk of cancer, even dementia. This is a recent study from Hong Kong showing that the people got a 20% lower risk of dementia after taking the statins. And also in type 2 diabetes patients, is lower risk of getting sepsis or septic shock. So actually, statin is quite good, right? It can help you to lower your LDL, protect you from cardiovascular disease, and it has a multifunction. Okay, and it is one of the lowest NNT choice in preventing cardiovascular disease. From this study, you can see here, actually, normally the statins is the 5 years NNT for prevention is around 100, below 100, compared to aspirin that we usually use to prevent cardiovascular disease, which is over 300. So that means that it is quite beneficial and it is cost effective. And the other important point is that statin is well tolerable. So in this REPRIEVE study, there's got only low level of discontinuation due to the adverse effect. And I think this is because they suggested the right statins, which is moderate intensity and which has the least drug-drug interaction with the antiretroviral therapy. So in conclusion, I think all of us can agree that statins can save life. And what does REPRIEVE tell us is that the LDL level-based statin prescription is not enough. And the CVD happen even in low-risk people, because the risk is always underestimated, and we believe that the statin has multiple functions. Just choose the right statin, and it is well tolerable. It is very useful to help us to maintain our long-term health and quality of life without CVD. Not even in people living with HIV, but also us. So I believe after this, if you take statin, you can just enjoy the char siu bao or the dim sum, whatever you want, without guilty. Okay, thank you very much.